A significant new development in a story we had for you yesterday morning, the attack on an elderly Asian man in Vancouver, 92-year-old man with dementia, attacked in a convenience store. And as you remember, yesterday, Vancouver police labeled it a hate crime, and they believe it may be tied to the pandemic. Well, here's the new development. Vancouver police saying they have identified the suspect, the man you see here in this video. Police say it was tips from the public that played a critical role in their investigation.
The Vancouver Police would like to thank the public so much for their outgoing support, and during this time, we're overwhelmed with all the information we got, and we're very grateful.
Vancouver police saying the suspect in the attack, you see him speaking there. He was yelling racist comments about COVID-19. He has apparently had previous dealings with police. He actually takes that 92-year-old man and just throws him out of the store. Anyone with information about this further being asked to contact police or Crime Stoppers. Now, this is not the only incident of the sort that we have covered of late. Many reports of increased racism, discrimination against Asians in the country, not just in the country, in the United States and around the world. Healthcare workers, not just healthcare workers. And we have a story this morning that's come to the public attention through a healthcare worker in Markham, Ontario. Dr. Joan Cheng is with us, an emergency physician at Markham Stouffville Hospital just outside Toronto. Good morning, Dr. Cheng, and thank you for being our guest.
Good morning, Heather. Thanks so much for having me.
Well, I'm really delighted to have you, and I'm delighted that you're bringing this story forward. It's not your own personal story, although I do want to talk about your own personal experience in part of this, but this is the story of a patient, a man whom you treated for a broken arm, and he allowed you to go public with the story of that injury. So let us do that. You ended up treating him, and what did you learn about how he ended up with that broken arm?
Well, Heather, again, as you say, my patient was gracious enough to give me consent to share his story because I thought it was an important one for people to learn from. But what happened, and this is just in the last few days, my patient and his girlfriend were on Yonge Street in downtown Toronto, and my patient was in his car, and his girlfriend was briefly outside the vehicle, whereupon she was assaulted by a strange man who was yelling at her because she is Chinese, and somehow that made her responsible for COVID-19. So he was physically assaulting this young woman, whereupon my patient understandably went outside the vehicle to defend his girlfriend. And at that point, two other men joined the original assailant, and these three men proceeded to assault my patient. And I won't go into all the details of exactly what happened, but then my patient sustained a broken arm. And as I was treating him, of course, we were chatting, and I asked him, did anybody do anything? And I was really happy to know that he said, like in his estimation, roughly 1 out of 3 bystanders, shop owners, etc., did come and speak up and try to come to their defense. And kudos to Toronto Police Services, who arrived very quickly, and they were apparently able to apprehend one of the individuals at that time.
Horrific. Did he tell you how he felt about what the attackers said or did to him?
So, he was really pretty stoic, and it actually made me quite sad when he said, this just happens. Understandable. And it was just almost this resigned attitude of, this is our reality as non-whites. And, that made me really, really sad that there was almost this level of acceptance of this type of race.
He just thought it's happening. Why do you think it is happening, Dr. Cheng?
Well, it is happening, but it has happened for decades. And this is part of the reason why I did want to post this story, is because if people are so lucky to never have experienced discrimination, racism, homophobia, I think they may have this concept that this doesn't happen, or if it did happen, it's something that resides in our past. But as a non-white person, I can guarantee you this is happening every day. And, one of the reasons why people may not know about it is because it is underreported. There are various reasons why victims of crimes don't report things. They think that people won't believe them. Maybe they think it didn't really happen. They think nothing will be done. And there's always the fear of, will there be repercussions if I report this?
Dr. Cheng, have you yourself faced any sort of racist overtone in comment or action toward you during this coronavirus pandemic?
I have not. However, part of that is probably because I haven't really been anywhere other than going to my workplace. And I think most patients wouldn't say something racist to their healthcare provider because that just doesn't make any sense. But when back in the end of January, when all of this was starting to unfold and we were hearing these reports from Wuhan, I was in Austria, and when I was flying home, it was just starting to make the news, and actually was really worried flying home via Germany about people. I was actually quite worried people were going to say things to my face or behave in a different way, and none of that happened. But I was a little scared.
Well, thankfully, it did not. But as you've heard in the news, we're talking about this incident in Vancouver. We're talking about a Conservative leadership candidate who's questioned Dr. Teresa Tam, whether she's working for Canada or China. The Prime Minister has had to respond to it. So obviously, these instances are happening right now in our midst. And I'm wondering, when you say fearful for yourself, I'm wondering what your thoughts are for post-COVID Canadian society and Canadian life. What do you think will happen?
It's hard to know, but I think it's important that we all realize that this is completely unacceptable and not understandable, and we shouldn't tolerate this behavior. The whole purpose of trying to highlight this issue is for education. And one method of education is to ask people to be allies if they see something like this happening. If you're unaccustomed to this and you see it for the first time, it is so shocking that often people are frozen, not because people want to help, but it is such unfamiliar territory that often people just don't know what to do and they don't know what to say. So if by sharing this story, I have been able to have people start to think to themselves, gee, if I saw this, what would I say, or what could I do? Keep myself safe, but also try to lend support to the victim. I think that is really important. By tolerating this behavior, we are actually teaching a terrible lesson, which is this is okay. So we have to unlearn that, and we have to learn now that none of these kinds of behaviors, whether it's a verbal assault, obviously a physical assault, none of this is acceptable and should not be tolerated.
Such an important message on Facebook originally, and we're delighted to hear that again as you tell us to our program this morning. Thank you very much, Dr. Cheng. The message to witnesses and to all Canadians from Markham, Ontario. I appreciate it. Dr. Joan Cheng, an emergency physician there at Markham Stouffville Hospital. Thanks.